is Dr. Aditi, and today we're diving into glandular epithelia. More commonly, you may know this as exocrine and endocrine glands. They are the two subcategories of glandular epithelia. Now, these are amazing tissue types because they are responsible for producing and secreting substances like hormones, sweat, and saliva. Now, to make things a little easier, I'm going to use a few analogies. So let's get started. But we're basically be talking about the difference between endocrine and exocrine glands and what they do and what happens when they don't do what they're supposed to do. So what exactly are glandular epithelia? As I mentioned, there are two categories, exocrine and endocrine. And I think of glandular epithelia as the chefs of this giant biological kitchen, right? Their main job is sort of whip up secretions that our body needs to function smoothly. Now, just like chefs work in different settings, our glandular epithelia work a little differently. Exocrine glandular epithelia are similar to chefs who work in a food truck, right? They have to travel to deliver their creation. Just like an exocrine gland, it needs ducts to sort of travel and get the secretion directly to the organ. However, endocrine glands are a little bit different, right? They're more like when you're dining in a restaurant. The chef doesn't have to go anywhere. He just sort of makes his creation, and then the waiter takes it from the kitchen and brings it to your table. So that's sort of like an endocrine gland. There are no ducts involved. Basically, the secretions are created and put in the bloodstream. The bloodstream's job is like a waiter's job, I guess, and it takes the secretion to the respective organ. So do you see the difference? Exocrine have ducts, endocrine do not have ducts, and they're directly released into the bloodstream. Okay, here we have a Venn diagram of the difference. Again, the exocrine have ducts that release sweat, sebum, enzyme, and mucus into the organ or the surface of the body. So it's a direct into the organ, right? Whereas endocrine, they do not have any ducts and they go directly into the bloodstream, and the bloodstream travels and takes the secretions, and they only secrete hormones. So that's a unique distinction right there. Endocrine only secretes hormones, whereas exocrine secretes other substances. Now, there's two organs that have both exocrine and endocrine functions, and that's going to be your pancreas. Pancreas produces insulin and glucagon hormones, but it also produces digestive enzymes, as we know, right? So that would be the exocrine function. And the liver has these insulin-like growth hormones that they produce, or it produces. That would be the endocrine function. And the exocrine function is that it produces bile or releases bile. So those are the two distinctions there. So the next thing you want to remember about exocrine glands is that they have three types of secretions. The first one is called a merocrine secretion. Now, this is the most common type. And what happens is these secretions are enclosed in these sort of bubbles, these vesicles, and they move to the apical surface where they're released by exocytosis. Mucus is a very clear example of this. And sweat would be another example, right? Now, the next one is apocrine glands, or apocrine, I don't know how you say it, but that would be a pinching sort of process. I think of it like, when you're playing with Play-Doh and you pinch a portion off. That's kind of how I think of it. Now, they release parts of their cell membrane along with the secretions in this sort of pinching process, and then this pinching process sort of portions off. This happens like in milk production. The secretion accumulates again near the apical portion of the cell, and then that portion of the cell and its secretory contents pinch off and are released. Examples would be in the axillary area and in the genital areas. And these actually release fatty secretions that local bacteria break down, and this is what causes that sort of body odor that we see. Now, important thing to remember is both merocrine and apocrine glands continue to produce and secrete their contents with little damage caused to the cell, because the nucleus and the Golgi apparatus sort of remain intact even despite, the pinching process of the vesicles. They're fine, as you can see in the picture. Now, the third category is not so lucky. The holocrine glands, this is where the whole cell breaks down to release this product. And this is going to be like in sebaceous or oil glands. It involves the rupture and the destruction of the entire gland. Poor thing, right? But then a new gland differentiates and sort of takes its spot and replaces it. So those are the three types of exocrine secretions. Okay, so what is the whole point of glandular epithelia? Well, you've probably figured it out, right? Homeostasis is going to be the key component here, whether it's exocrine or endocrine. These glands keep our body in balance. For example, like we talked about, sweat glands act like cooling systems and prevent us from overheating. And then we've also got a bunch of hormone secreting glands like thyroid, who are like the timekeepers, regulating metabolism and monitoring our growth. And then salivary glands help us break down food. So you can see they're different. And of course, there's mucus and other things. But you get the idea. It's all about maintaining a balance in our body. So what happens when homeostasis is not achieved, right? When things are not going well and the glandular epithelia are not doing their job properly? Well, there are various issues that arise. If you look at exocrine glands specifically, the duct glands, right? These have ducts and they produce substances like enzymes and mucus, etc. There's several problems. Acne is a very common one. This relates to the sebaceous glands. When they don't work well, that's when we get acne. Sjogren disease, this is an autoimmune disease in which the lacrimal or tear glands and salivary glands do not function very well. And this, leads to things like the mucous membranes and moisture secreting glands being affected, and you have this sort of gritty feeling in your eyes because your eyes get dry because they're not, releasing enough lubrication. Dry mouth obviously is going to be another complication, which can actually cause dental issues because you've not got enough saliva. Also, it can lead to coughs, chronic cough, because the mucous membranes in your lungs may be impacted. Dry vagina is also another factor here, because then that can lead to yeast and fungal infections. Dry eyes can lead to vision problems, etc., etc. So it's not as simple as it sounds. It's not like, oh, I've just got dry eyes, right? It can lead to a lot of other issues. Then we've got cystic fibrosis. Now, this is an inherited life-limiting disease that affects so many organs. So it's a genetic disorder where there's a faulty protein that affects specifically exocrine glands that produce sweat, mucus, and digestive enzymes. So what happens is too much of the substance is produced and it's thicker than it should be. And so symptoms can really cause so many problems in the body. Obviously, in your lungs, it's going to cause a lot of respiratory issues. It can cause digestive issues and vaginal issues, right? And reproductive issues also. So it's got a lot of issues, and this impacts a lot of people. But new treatments are increasing life expectancy for people with CF, which is great news. Now let's take a look at endocrine glands. What are the health problems related to endocrine glands who exclusively release hormones? So for example, the thyroid disease is going to be a common factor when endocrine gland like thyroid is not working well, right? For example, in hyperthyroidism, this is an overactive thyroid and too much of the hormone is going to be released. And this causes symptoms like weight loss, hand tremors, rapid or irregular heartbeat. And the reason is it speeds up the body's metabolism, right? So it's going to cause all those symptoms. On the other hand, we've got hypothyroidism, which basically means that not enough of the hormone is being released. And hormones are crucial to metabolism, right, and regulation. So this may cause issues like fatigue, weight gain, and cold sensitivity, right? So those are just two examples for the thyroid disease. Then we've got polycystic ovary syndrome. Now, this is where there's this imbalance of hormones, right? and it can cause things like irregular menstrual cycles, excess hair growth due to androgens, and also abnormal growth on the ovaries. So again, very, very deleterious. Another example is adrenal insufficiency, which basically means not enough hormones are produced by the adrenal glands, like cortisol or aldosterone. Early symptoms of Addison, can affect in so many ways, but some things may include loss of energy, tiredness, dizziness or fainting when you're standing or laying down. Also, sometimes low blood pressure, etc., etc. So there's a whole gamut of them. But basically, these are the problems that you might see when the endocrine gland is not working as it should. In summary, I like to always use a mind map because it sort of gives you a nice visual, spatial, global perspective on things, and it also helps you sort of see the hierarchy and relationships, right? So glandular epithelium, there are two types, exocrine and endocrine. Exocrine is the one that has ducts and it's directly delivered to the organ. Secrete sweat, sebum, enzymes, and mucus. There are three types of methods of secretion. Merocrine, which is your vesicles, little bubbles with the secretion in it. Apocrine, which is sort of the pinching. And then halocrine, which is destroying or destruction of the cell when they're secreting the substance. And then endocrine, as we know, their methods of secretions are really one way, directly into the bloodstream, and they only secrete hormones. There's no ducts involved, right? And then I've got some examples of exocrine and endocrine glands, which are probably very familiar to you by now. One thing I wanted to point out, in the intestines, there are things called the Brunner's gland, and they secrete specific type of gastric juices, so that's something to remember. Now, there are two organs in the body that have both exocrine and endocrine functions, so that's really important to highlight here, because a lot of the literature I see, a lot of the images I see endocrine versus exocrine. Very few sort of bring the two together, and the pancreas and liver are going to be those two organs. The pancreas has an endocrine function in that it releases hormones like insulin and glucagon, and it has an exocrine function because it also releases digestive enzymes. The liver has endocrine functions in that it releases insulin-like growth factor, and exocrine functions where it releases bile. So there you have it. There's your summary. Lastly, I wanted to show you that I do have an ebook which is free to download on my website, which has that mind map that you just saw in there, and it has some very interactive activities to help you learn and reinforce the content that we have talked about here today. So thank you so much, and do leave a comment and let me know if this was helpful.